It's a people, it's a community, it's a life, it's a heart, it's a spirit.
The heck would you want a picture of a tattoo of $1,000 on your penis for?
The medications that have now come out really make HIV a manageable disease.
Like I said, in today's market, real estate alone has gone up 15%.
So sometimes there is no battle. Lately, if I don't get my musket dirty, that's great with me.
The cops were pushing her and egging her on to get her nuts. They were calling her names.
And then I find that the actors and actresses, for the most part, are like sponges. They soak up whatever you get back to them.
And he kept explaining to me that I wasn't gay, that you cannot be gay.
Religion and spirituality are big topics these days. I mean, the bookshelves, the bookstores are full of
incest, not funny. Midgets, not funny. Incestuous midgets.
Getting funnier.
Good evening and welcome to Talking About. My name is John Griffith and I am your host, and tonight we are talking about glaucoma. My guest tonight is Edith Marks, author of the book Coping with Glaucoma. Welcome.
Thank you.
Let's just dive right in and get down to the eye.
Good.
How does the eye work, or how is the eye supposed to work properly?
Well, let's take a look at this diagram of the eye. The eye is a small, wonderful organ, and in it, it has all of the features that allow you to see. Now, light comes in passes through the cornea, which is that very thin layer that covers the eye, and it goes through the pupil, and it is picked up by cells here, neurons, to the retina, and this is the retina that comes around like this, and the cells in the retina, the neuron cells in the retina, form ganglion cells, and these ganglion cells, these fibers, they're long fibers, and they come through here and they form the optic nerve. Now, the optic nerve carries these light messages into the brain. That's in the back of the brain, right in the back of the head, which is the vision center, and that is where it is interpreted. Now, a number of things can go wrong in this particular area. With glaucoma, one of the factors that goes wrong, well, there are several, but the one that we can do something about at the moment, we're hoping that we can do something about optic nerve disease, is right in here in the trabecular meshwork. There's a little angle here, and this in the angle there's a tiny little area called the trabecular meshwork. When this gets clogged up, the fluid from the ciliary body, right here, the ciliary body, which makes fluid, and the fluid is nourishing. It contains vitamins and oxygen, and it's very necessary for the eye. However, it is a system where it must leave the eye because the ciliary body keeps making the fluid constantly. And so there has to be an egress, and it should go out through the trabecular meshwork and then through the Schlemm canal and out into the system of the body. Well, if there's a clogging there, it backs up and you get eye pressure right in here. You get eye pressure. And as soon as you get eye pressure, there is an effect on these ganglion nerves, and they are very sensitive. They're very thin, and they're very sensitive.
Very tiny, very sensitive.
And they begin to die, and that is one of the main problems.
Is that basically the gist of glaucoma? Is that the firm?
That is only one of the problems.
Can glaucoma be summed up in a nutshell, or is it just a myriad of issues?
It's a myriad of issues. The more we've learned about glaucoma, the more we find that we need to learn. There may be a genetic problem where in any number of the areas of the eye, it is now called an optic nerve disease because there are some people who have high pressures and they don't have glaucoma. They don't lose any sight. And there are other people with low pressures, which we would consider low pressures.
But what is a normal pressure?
Right. I knew we were coming to that. Right. There is no normal pressure. When I first got glaucoma, which was some 28 years ago, we used to think that the pressure was between, well, up to about 21 millimeters of mercury. And if anything went above that, then it was high pressure. Well, we discovered that people at 21 millimeters were losing sight. And so they brought it down to about 15 or 16. And then, lo and behold, a group of people had something called low tension glaucoma. And that had to go down even further. And then there are people who are susceptible even at the 13 or 14 or 12, and they bring the pressure down further. And while pressure is not the only thing, pressure happens to be the one area that doctors can do something about. And so this is where the main concentration is. But where the research now is focused is on the optic nerve and on genetic research to change what is happening in the eye, possibly stem cell, possibly implantation, but it's still a long way to go.
Right. Well, I mean, you talk about genetics. Is there a specific genetic group that's at risk or an ethnic group?
African Americans are more at risk. They get glaucoma 4 to 6 times more than the white person, and their glaucoma is more severe. There are several types of glaucoma. Actually, there are 40 types of glaucoma.
Okay, I have a feeling we're not going to get to all of them in today's show, but I just want to make a little aside to our viewers that we are taking your calls tonight. Area code 718-460-9802, and we would appreciate any questions or comments that you might have. Okay. Is there any particular reason why African Americans might be more at risk?
There are speculations. One of them is that they need more aggressive therapy. Another speculation is that their corneas are thinner, and so the reading of the eye pressure is not as accurate. These are speculations, though, and we just don't know. At least I don't know. Doctors may have, at this point, may have some more insight into the reason for this, but they really, it seems to be happening more among this particular group of people. But also another group of people who are very susceptible are people over the age of 60. The aging eye.
Which is going to be my next line of questioning. So
the aging eye, and of course the aging eye is susceptible to macular degeneration and susceptible to cataracts. So, and this may be caused by, in some cases, macular degeneration, diet.
Which we'll be discussing in detail.
Yeah, we're going to talk about that later, sure.
But, all right, well, just starting at the beginning, I mean, what warning signs might people encounter
well, I'd like everybody in this audience to cover one eye and then cover the other eye and see what you see, because sometimes what happens is that, do you see the same with both eyes?
Well, my eyes are corrected, so right now
that's all right.
It's pretty close to the same.
Okay. Especially people who have 20/20 vision, because they have a perfect vision. They seldom go to an ophthalmologist, and they may be losing sight in one eye and never know it. And that's one of the ways that you can tell.
Would it be from the periphery? And
Yeah, yeah. With glaucoma, sight is lost more in the periphery, although some people do lose sight in the center too, but that's usually later. It's the periphery. Where people may notice it is that when they're driving, they're not seeing out of the corners of their eyes. And if they don't use their mirrors, they may run into trouble. And I knew one woman who was crashing into everything. And
that is not a good thing.
And she was telling me about these crashes. I said, look, have you been tested for glaucoma? Because it sounds like your periphery is gone. And this also is a problem because you need the periphery for balance. And so when you lose periphery in the eyes,
so your equilibrium can seem to be off. And
yeah, right, and that becomes a problem. But we recommend that everybody over the age of 30 see their ophthalmologist at least once a year, if not more, for an eye check.
So annual checkups are key just to protect your
Yes,
vision.
yes, absolutely,
and
absolutely. Now, optometrists automatically now take pressure checks, and an ophthalmologist certainly will. But a pressure check alone does not tell you whether you have glaucoma. It gives an indication that you may have glaucoma, but it doesn't tell you that you have glaucoma.
Okay, so it brings it to the suspect.
You become, yeah, and you need to have an examination of the optic nerve and a visual field. Now, what is a visual field?
Yes.
A visual field is to check whether you see periphery and your central vision. It checks the 180 degrees of your eye. Now,
so if you want to just kind of give yourself a quick test, would you just do the 2 fingers?
You can do 2 fingers, or you can look at the center of the room and see if you see both walls without moving your eyes.
Both walls on the sides?
On the sides, without moving your eyes.
Okay. Well, I see both corners, so I'm at an angle, so that...
Right, okay, yeah. If you don't see both sides, then you may be losing periphery, because you should be able to see both sides. Walking down the street, you should be able to see the other side of the street as you're walking down the street. That's peripheral vision.
Okay.
So there are many ways that you can test it. Yes, and the way you did with your fingers, that too is peripheral vision. Sure.
Okay.
By the way, with peripheral vision, the eye has 2 sets of cells, and one set is the peripheral vision set, and you don't have as many of those as you have. Those are the rods. The cones are right in the middle of the eye. They're right in the macula, in that tiny little, like yeah, right in here. The macula is about the size of a pencil eraser. Now, and in that there's also a tinier area called the fovea. This is where you see distance. This is your reading area, this tiny little area.
So the size of a pencil eraser.
Yeah. This is, and it is packed, absolutely packed with cones, because it needs all of these cells in order to give you that kind of precision of seeing.
The body is one incredible piece of work.
Incredible. The eye is one of the most incredible, because what happens in the eye, that to take light and be able to transform this light into objects and seeing, it's absolutely astounding.
Mm. Okay, we're going through the testing process. You suspect, you go through to a routine eye exam
Okay.
and it's suspect.
All right, with the routine eye exam, the ophthalmologist uses an instrument called a tonometer. And
Is that the little puff?
No,
No,
well,
it's-
you can use a little puff, but that's not that accurate.
Okay.
This barely touches the eye. The eye is anesthetized, and this barely touches the eye, and it gives the pressure. It's called a Goldman tonometer.
So it's almost like checking the pressure of a tire, I guess.
Well,
is
maybe.
it- I don't know. I don't drive either, so I'm just guessing.
It checks pressure. Yeah.
Okay.
Then the doctor will take a look at the inside of the eye, and this is to examine the optic nerve. And then the third is the field test, and the field test is you sit in front of this dome, and tiny little lights come at you, and every time you see a light, you press a buzzer. And it gives a computerized reading of what you're seeing. The people who have glaucoma and who have serious glaucoma become very concerned if they don't see enough of these lights, because then they know that they have lost vision. And this is one of the most accurate ways to determine vision loss. There are other...
Can the machine compensate for human reaction time? Some people might hit the button a little.
Yeah, the machine does register errors, and if you make too many errors, the machine registers that, and you should really take the test over again. It is a subjective test, and there are other objective analysis of the field, but these are more expensive, and not every ophthalmologist has them. There's something called a retinal analyzer, and there are...
do they get quite invasive, or is it beyond...
There is nothing more invasive than just the touching of, of the eye. That is the only invasive part, and that's really not invasive in the diagnosis. It's and any kind of diagnosis just barely touches the eye.
And is a diagnosis saying, I guess, multiple tests would prove with 100% certainty, or is there still...
Yes. I don't know if there's ever 100%, but when you have glaucoma, doctors pretty much know you have it. And you know you have it if you're losing sight. Once the sight is being lost, you know you have glaucoma.
Right. How important is a second opinion once you are initially diagnosed?
Well, I'm not too sure the second opinion is that important in the original diagnosis, because the treatments are pretty standard for that. And if there is loss of sight, then something is happening to the eye. So when second opinions are sought after, it's usually when the doctor wants to do a more invasive therapy. And at that point, there is a troubling kind of decision to make.
Right. Is that necessary in a timely fashion? I mean, does that usually need to be done as quickly as possible when it comes to starting treatment?
Treatment is usually started immediately when you have glaucoma. In this country, still, treatment starts with eye drops and then moves on to the more invasive therapies. Now, there have been a number of studies recently coming out of Europe, and they have found that patients do better with an operation called a trabeculectomy.
Which is?
Rather than the drops, where they make a little hole to allow the fluid to flow out. And they find the patients do better with that because they don't lose as much sight. Now,
But here,
Doctors in this country don't like to do that because there is much more risk with an operation, because this is an operation.
right,
This is cutting, because you use a scalpel and you use a scalpel to make a hole. They're still resistant to the trabeculectomy first, although studies do say that it can work and it can work better. There are also studies that say that laser treatment first will work better with certain kinds of eyes than the drops. See, the drops, while they don't seem that invasive, can cause other problems.
right. I was just going to ask you about side effects or.
They all have side effects, and with every patient has his own set of side effects. Some patients do very well with the drops, and other patients do very badly with drops. Some patients are allergic to all of the drops. We have recently discovered that the allergies, in many cases, are the preservatives in the drops, and some patients need to have preservative-free drops.
Okay.
But these are more expensive, and they're more difficult to work with. Some years ago, a number of doctors came up, I think it was Dr. Rich who came up with this, that if you occluded the tear duct in your eye, which is right in here, the drop did not cause that many allergic reactions, because when you put a drop in your eye and you don't occlude your teardrop, it goes right into the tissues of the nose, and it acts like a hypodermic. It goes right into the body system, and you can get very difficult situations. This happened to me with a particular drop. I was taking it nicely for a number of years, and suddenly I became very sensitive to it, and I didn't know what to do until I discovered that I could occlude. And at that point, I was able to handle the drop, because this particular drop was practically the only drop that I could use.
So, yeah. And we have a caller. We have Gloria on the phone. Gloria, feel free to ask a question. Say what's on your mind whenever you're ready.
Hi. I was told that I had glaucoma earlier this year, and I was taking drops for a while, and then I visited all kinds of doctors, and one doctor said, let's try to get off the drops, and I did. And interestingly enough, my eye pressure went down. And although I have some vision loss, I see blurry, I don't seem to have the eye pressure up. And now I don't know at this point whether I have glaucoma or not. I mean, if my pressure goes down, does that mean I no longer have glaucoma?
Not necessarily. You can have a fairly low pressure and still have glaucoma. The proof is in whether you are still losing vision. If you're still losing vision, then something is happening in the eye. One of the problems with low pressure or normal pressure is that you may not be getting sufficient blood flow to the eye.
Well, in my case, I've been told I have hemorrhaging.
That has nothing to do with blood flow.
That has nothing to do with glaucoma?
Hemorrhaging is weakened blood vessels, which can happen with people who have glaucoma. The blood flow to the eye is very important because it carries the nutrients and the oxygen. And if the eye doesn't have enough blood flowing into it, it becomes ischemic, it becomes pale, and the optic nerve becomes pale and then begins to lose. So I would suggest that you see an ophthalmologist on this and perhaps check the blood flow. And again, there is something called the Heidelberg Retinal Analyzer, and that would determine what your retinal layer looks like, because it it can it can be quite serious if you are losing sight. If you're not losing sight, you may have been one of these lucky people who really doesn't have glaucoma, and there are people like that. But
well, my sight is hazy. That's how I would describe it. I have 20/25 in one eye and 20/40 in the right eye. So definitely I used to have 20/20 in both eyes, so there's definitely a change. I don't know.
Your acuity probably would not be affected that early with glaucoma.
Mm-hmm.
The slight myopia that you have is really doesn't seem to be that serious, but the haziness is something that you should look into, because with your visual acuity, it doesn't sound like your eye should be hazy. It should be clear. How about cataracts?
No, I don't smoke. But I think, I really think computers are hurting people's eyes. Even though I mentioned it to the doctor and he says no, I think they don't know enough about them, because I notice when I sit at a computer, my eyes really bother me, and they burn, and so I really think that my problems have been caused by the electromagnetic fields coming from the computer.
Very possibly, very possibly. Also, you might change the screen on your computer and use a screen that will give you better definition, because the computer screens are very bad on the eyes. That white screen is very bad for the eyes.
Are the LCD screens any better?
Yeah, they're better. I use white on black, which gives the best definition, and my eyes don't get tired from that. But recently I switched to the lighter screen, and I found that I was getting irritation also. So, do you use the computer a lot?
Yes. Yes, I do. Too much.
Yeah.
Yeah.
May I suggest that you rest your eyes every 15 minutes? And by resting, I mean just look in the distance. Close your eyes, look in the distance. You can also do something called palming, and this is, you do this, just put your palms over your eyes and do that for several minutes. Give your eyes a rest. It's very important when you're using the computer, because one of the problems that's happening, and this may account for your loss of vision in one of the eyes, that staring is what you do when you're looking into a computer. And staring is very bad for the eyes because it causes the eyes to become myopic. If we didn't teach children to read, they probably would not become myopic, because the conversion of the eyes onto the page causes myopia, causes nearsightedness. It, yeah, right.
Well, I don't want to take up all of your time, but I have one more question. I mean, I'm farsighted. I see better from far away.
Sure,
so
you are. Yeah, with 20/25, you are farsighted.
Yeah. And I want to. I didn't see the beginning of the program, but are you a sufferer of glaucoma?
Yes, I am.
Okay. Has it affected your vision? I mean, obviously it has, but
yes.
Is it progressive or?
Yes, my glaucoma has been progressive, but I still have relatively good sight.
That's great. Oh, thank you very much.
You're very welcome.
Okay, thank you for calling, Gloria.
Okay.
And you are watching Talking About, and we are talking about glaucoma tonight. My guest is Edith Marks, author of Coping with Glaucoma, and we were just discussing surgical treatment options.
Right, okay. So if the drops don't work, and there are many drops at this point. When I first started with my glaucoma, there were just a few. But now there are a lot of drops, so that doctors can keep changing off to the various drops. One of the most popular now are the Zolatan and Travatan, which are prostaglandins. prostaglandin derivatives, and these seem to cause the least distress. They make the eyelashes grow longer, and people kind of like that. And until these drops came on the market, the beta blockers like Timoptic, this was the golden drop that they all use. Yeah, the gold standard.
Okay, what is a beta blocker?
It blocks a certain area in the eye, and what it does is it let me see if I can explain this in a way that's it blocks the fluid in the ciliary body. It kind of blocks it from making so much fluid.
Stops production.
Yeah, not completely, but it slows the production down.
Okay, so think of
so
it as
it works on these beta cells.
Sort of the OPEC of the eye.
Right. Yeah, right. So this is what the beta blockers do, and what the prostaglandins do is they push the fluid out of the eye, and so sometimes the two of them work very well together. The part of the reason is to stop as much fluid as you can, because otherwise it's going to back up. Well, when the drops stop working, when there just is no other alternative on the drops, the doctor will offer laser treatment. And what laser treatment is, it, excuse me.
So, laser treatment.
The doctor makes tiny little scars, tiny little scars along the periphery of the trabecular meshwork. They're not terribly sure why this works, but it does. It lowers, in most cases. Unfortunately, one of my colleagues just had it done, and her pressure went up, which is very unusual, but sometimes this happens. With the laser treatment, you still have to use drops. It generally lowers the pressure about maybe 5 to 10 points.
Is this an inpatient or an outpatient procedure?
They're all outpatient now.
Okay.
Yeah, so it takes 20 minutes to do the laser treatment, and then the doctor has you sit in the office for about 3 hours to make sure that the pressure doesn't go up. And there's some kind of medication that you probably take after that. Now, this will last 5 to 7 years.
Okay, so there's a good success rate.
There's a success rate. It will last 5 to 7 years, but then you're back to where you were before. Your pressure now starts going up again, and the doctor may do the other half. The doctor only does one half of the trabecular meshwork, and then he'll do the other half, and maybe you'll get another 5 or 7 years. But at that point, the doctor may decide that you really need to have an operation. And the operation is making, I'm really not going to go into the description of it. It's a little complicated, but it's making a hole, so that the fluid can flow out of the eye.
So it's creating a drain, really.
Unfortunately, the eye does not like to have a cut in it. Just like if you cut your finger, it's going to heal. So the eye wants to heal this, and it very often scars over. This has been a problem until, maybe about, I guess it's about 10 years now. They found out that they could use a couple of cancer drugs, 5-FU and mitomycin C. And when they apply these drugs, tiny bit, to the site, it kills those fibrin cells
that would cause the
otherwise
scarring.
scar. And so the trabeculectomies have a greater chance of not healing. Because if they heal, they scar, and then you're back to where you were
So
before.
this is just a case where healing is bad. Yeah,
Healing is bad in this
the
case.
immune system is working against you.
Right. And if you're lucky, your trabecular meshwork, your trabeculectomy is going to maintain, and you're going to have a decent pressure. If you're not lucky, you may have the problem again, and it will scar over. So this is a problem that people with progressive glaucoma face, and it's not a happy problem.
Does repeated surgery increase risks in other areas?
Yes, it does. Repeated, and it is also less effective. And there are only so many surgeries you can do in the eye.
Right.
Because the eye is small, and so they're just 3 is about the most.
Yes, this is not actual size.
No, it's not.
But okay, after surgery, I mean, what are the quality of life issues? I mean, is there good living with glaucoma? I mean,
we've it's not easy if you have progressive glaucoma, because a number of things affect the quality of your life. One is your balance. Another is glare. When you go out into a bright day, very often there will be glare. And
so, is that resulting from the disease or from the surgery, or either?
It results from the disease, because certain cells get lost. You lose your peripheral vision. You become, and also since it affects many people who are older, it seems to increase their susceptibility to falls, because they don't really quite see the sidewalk, for example, because you lose peripheral vision also. Your peripheral vision is all around the eye, and so you lose it. You don't see your feet.
Okay.
And so unless you're always looking around.
Right, which is, yeah.
And if you're busy talking to somebody as you're walking, you just may not see an impediment. So this is a problem. And we've had people who walk into glass doors. Now, I know people without glaucoma also walk into glass doors.
Yes. No comment.
Right. But I think it happens more frequently.
Yes, but we won't admit to it. And we do have another caller.
Okay.
We have Marie on the line. Marie, feel free to say hello whenever you're ready. We will take your question. Hello?
Hello, Marie.
Hi, I'm Marie.
Yes, Marie?
I have 2 questions.
Okay.
One, I'd like to know, has anyone done any studies on makeup, eye makeup, and how it might hurt the eye? And the other question I have is about alternative therapies, like acupuncture and chiropractic. I mean, I come from a type of thinking that kind of goes that way, and lots of people have been recommending that kind of thing to people that have glaucoma. What do you think about those 2 things?
All right, with using eye makeup, you have to be very careful when you use eye makeup, and this is for anybody using eye makeup, that there's no bacteria on the brush. There's a lot of bacteria on your lashes, and using using a makeup brush constantly on the lashes can aggravate this bacteria, and once it gets into the eye, you can get an infection. If you have glaucoma, it's even more difficult. So I would just not advise anybody who has glaucoma to use eyelash makeup. Certainly you can use it on your brows. Now, for alternative therapies, I've written about a number of them, and
And actually, we were just about to get into that.
Okay.
So
Yeah, you asked about acupuncture. It would be really wonderful if acupuncture did work, but I couldn't find any real evidence that acupuncture does work. There are other things that I find are more effective, and one of them is vitamin therapy. There's something that happens in the body called free radicals. I don't know if you've heard about that, but free radicals destroy cells, and they destroy cells by stealing an atom from another cell and disabling it. And when this happens, then you begin to lose cells. Now, the way to counteract these, actually you need the free radicals in some cases because it helps with the digestion process, but it can also be very harmful. And the antioxidants are very good to handle the free radical problem. And the antioxidants are the E and the C, and many of the Bs do that also. Then there are any number of herbs, herbal remedies that can be helpful. One particular one that is ginkgo biloba, which is used in Germany for treatment of the eye. Yeah.
okay, and I think we've lost Marie, but we do have Richie on the phone now with another question.
Yeah, hi. I'm enjoying your program. It's very good.
Thank you.
And
What's your question?
I wanted to know, is there any specific age that glaucoma starts or begins, or could it affect anyone?
Other than the senior set, can it affect children?
Oh yes, babies get glaucoma. There's something also called juvenile glaucoma, and anybody can get glaucoma. When a baby gets glaucoma, it's very easy to see because they develop something called cow's eye. The eye bulges out, and that's because the sclera is very tender at this point and can swell. It becomes much more rigid as an adult, and so you don't get the cow's eye. But yes, babies get glaucoma, and they need operations almost immediately to handle their particular problem. There's a whole set of youngsters who have juvenile glaucoma, and actually juvenile glaucoma, it's called juvenile until you're in your 20s with glaucoma.
Okay.
And people, we have a support group, and a number of people in their 30s got glaucoma. There is a glaucoma called pigmentary glaucoma, and younger people get this, and this is pigment that in the eye, it comes off of the iris.
So that's where the color of your eye is.
Yeah, the iris is the color part of your eye, and the pigment comes off of the iris, and this gets into the trabecular meshwork.
Oh, so it sort of flakes off and clogs the drain, so to speak?
Yeah, it clogs the drain. This seems to happen more with young men because they have larger eyes, and so there's something called the zonules that hold the eye the iris in place, and the brushing of these zonules it causes this flaking of the pigment.
Okay, thank you for calling, Richie.
Wait, I didn't finish.
Okay, one more.
More question. Is that okay?
Yes, feel free.
I just wondered if diabetes, which affects the blood vessels in the eye,
absolutely,
would that have anything to affect?
Absolutely. Diabetics have something called diabetic retinopathy, and this is an overgrowth of blood vessels, runaway blood vessels. Which can also cause glaucoma, and this is a very dangerous situation because diabetics can lose sight very, very rapidly.
Wow.
that's one of the leading causes of blindness in glaucoma is the diabetic retinopathy.
Wow. Thank you so much for that. It's
You're
very
welcome.
informative.
Right. Thank you.
Thank you. Bye.
Okay, and in just another second, we have another caller who's going to be put through in just a moment. Edith, whenever you're ready, Edith, we will be glad to take your question. Edith? Hi, Edith.
I just had surgery for glaucoma in March with laser surgery. I just wanted to ask you a question.
Sure.
Is there anything I should stay away from as far as alcohol or foods or exercise, anything that would compound upon my glaucoma?
Exercise is excellent. Do as much exercise as you possibly can. And
For the eyes, I mean.
Aerobic is great. You can
Yes.
do anything you want with the eyes. Alcohol is another problem. They say that 2 drinks is okay because your pressure goes down with it, but unfortunately alcohol turns to formaldehyde in the system, and you really don't want to have that in your system when you have glaucoma. So I may be in the minority, but I feel that alcohol is not a good thing with glaucoma. Other than that, you can do anything that you want to do. Eat organic food, eat lots and lots of fresh green leafy vegetables, eat your kale, your broccoli. All of these are helpful. They all have the antioxidants in them that help to destroy the free radicals, which are important for the health of the eyes.
I see. What about the yoga exercises for eyes?
Yoga is fine, but don't do the stuff where you're standing on your head.
I see.
Don't stand on your head. Don't get your head down between your knees. Keep your head above. Yoga is actually, I think, a little bit better than karate, because with karate you can get a hit in the eye, and you don't want to have that.
I see.
But yeah, yoga is wonderful, because yoga, meditation, that's absolutely great.
Okay. I find that when I go out in intense sunlight, then I have pain. Or if I go to a party and they take pictures and they flash lights in my eye the next day, I have like a redness of the eye. Is that a problem? Should I speak to my doctor about that?
Speak to your doctor about that.
I appreciate it.
I don't have any opinion on that.
All right. Ms. Marks, thank you so much. I will gain your book, and I will read it.
Thank you.
Thank you so much.
Thank you.
Thank you for calling.
Bye-bye.
Bye. Okay, just we have about 10 minutes left.
Okay.
Okay, so alternative medicine can be helpful in conjunction with traditional.
Yes. I do not recommend that you stay only with alternative.
Should you keep your doctor in the loop as to what you're doing to?
I think it's a good idea. Doctors are now becoming more permissive about vitamin therapy, and they like to know what you're taking. And there are a number of vitamins now on the market that combine the antioxidants and something like taurine, which is very good for the eyes.
So it goes hand in hand with good nutrition.
It goes hand in hand with, and good nutrition is extremely important. Good nutrition, exercise. There are actually studies that show that exercise, aerobic exercise, does lower the pressure.
So low impact, high impact. Can high impact be harmful?
High impact can be harmful if you have pigmentary glaucoma and exfoliation glaucoma, which is what I have. I have exfoliation, which means that the little white flakes somehow happen in the eye, and they get into the meshwork. So in this case, high impact is not a good idea. But walking is wonderful. Walking is wonderful, and running in some cases is fine also.
So, but again, you should keep your doctor in the loop.
Oh yes, oh yes.
So, and we mentioned positive foods that we should eat. Are there any things other than alcohol that people should avoid?
Well, don't think fast foods are a good idea for glaucoma. One of the things that I would recommend, though, is essential fatty acids. Now, these are the omega-6s and the omega-3s. The omega-6s are the oils that you get from seeds and nuts, and the omega-3s are the oils that you get from herring and salmon and sardines and flaxseed. These are the wonderful ones.
Okay.
And the problem is that people get 20 to 1 with the 6s, and it should be really 1 to 1. So it shows you be very careful on your other oils.
Okay, and again, speak to your doctor. Even your regular physician can
Your regular physician,
help with good nutrition.
but more importantly, a nutritionist.
Okay.
In this case, I think a nutritionist is very important for people who have glaucoma.
Because, I mean, it can take both a physical and a mental toll.
Right, absolutely.
Which brings us into what kind of support is out there for the stress of all this, because it's a tough thing. I mean, it's especially initially a shock to the system, and it's an ongoing thing.
It's very difficult. We in New York are very fortunate to have a glaucoma support and education group, and it meets once a month at New York Eye and Ear on the third Saturday, and anybody is welcome to come. It's free, although we ask for a donation because we do publish a glaucoma newsletter, where we recapitulate what doctors have talked to us. We have a lecturer at every single session, and it's you can find out more about this by calling the Glaucoma Foundation,
which is area code 212-285-0800.
Yeah, right.
And is the information on the website as well?
The information should be on the website. I'm not sure it is, but the website is something very important to take a look at, because there is a lot of information there. And that's Glaucoma Foundation, www.glaucomafoundation.org. And it's they will eventually, it's part of the process now, be getting the various newsletters on there too. And people really do love the newsletters because it gives a lot of information.
A lot of information, keep you up to date on the latest things.
Yes, absolutely, absolutely, yeah.
And different kinds of meetings. So, I mean, what different kinds of support groups are there as well?
Well, there are support groups throughout the country. Basically, the Glaucoma Support and Education Group in New York City is I would say the most important one for people who have glaucoma. There are other support groups for eye diseases, but this is the one should go to, because there you can also meet people who have, surprisingly, who have your kind of glaucoma. At our last support group, we had a couple of men who came in with closed angle glaucoma, which I didn't talk about. We'll have to do this another time.
Yeah, well, you can give a brief
closed angle glaucoma is a functional glaucoma because it happens with the conformation of the eye, and it usually is helped by a tiny little operation done with a laser called an iridotomy that allows the fluid to go out. And it's the way the eye is structured, and usually happens with people who are farsighted because their eyes are smaller, so that they don't have quite as much room in the eye for everything to go on in there. It can be serious. And the way it can be serious, and this is important, is that if there is a blockage, if the iris moves into the angle, it will cause a blockage that can then have the fluid back up to such an extent that the pressure can go way up to 60 or 80 or something like that, and the person can lose sight in a day. actually lose the eye in a day. And so if this ever happens and you see halos and you have a headache and you know that something terrible is going on, you must
Get thee to
immediately
a doctor.
go to a hospital.
Emergency room.
Emergency room, because that pressure has to come down immediately. And we have had cases in our group where this has happened, and a great deal of sight has been lost.
Okay, and well, that's what we hope to prevent.
Absolutely,
And just,
absolutely.
Yeah, a brief recap. Yeah, suspect. Get your regular eye exams.
Yes, yes.
You said over 30 annually.
Over 30, yes, absolutely.
And even under 30. I mean, yeah.
Yes, people should be examined by an ophthalmologist. It's really quite important, because they know what to look for in the eye.
And diagnosis, swift treatment, including good nutrition. Yeah, you can work in alternative medicine, but keep your doctor in the loop.
Yep.
And and you're not alone.
And meditate.
Okay.
I didn't talk about meditation, but meditation is great because it relaxes the eye, and and sometimes pressure can be brought down that way too, by meditation.
Okay, and yeah, there is a wealth of information in your book, Coping with Glaucoma.
Thank you.
Can't tell you to run out and buy the book, but
it's also in the libraries.
Yes, but go to the library, and take it out, take a look. Yeah, it's there in your library for free. Yeah, I'm not going to tell you to go to Amazon.com and get it, but it's at your library. And again, I want to thank you. We're going to have a nice long credit roll with all the information of the website and the phone number again, which I'm going to verbally give out now. It's the Glaucoma Foundation.
Right.
And the phone number is 212-285-0800. The website is all spelled out, glaucomafoundation.org, www.glaucomafoundation.org. And I thank you again.
You're certainly welcome.
And you've been watching Talking About Glaucoma. I'm John Griffith, your host. My guest, Edith Marks. And I hope to see you again real soon. Check out the show's website, www.talkingabout.info. And you can write to me at Talking About, Box 20713, Floral Park, New York, 11002. And I'll see you next time. Thanks. Good night.